All right, we'll get started. Good afternoon, everyone. Thank you for joining us. My name is Kathryn Goodman, and I'm the Public Information Officer for the Thomas Jefferson Health District. In true spirits of what we're promoting, we are starting with our cloth face coverings on, but Dr. Bonds and I are the only ones in the studio. So for you guys to hear us throughout, we're sitting 6 feet apart, and we will remove our face coverings so that it's easier for you to hear us moving forward. So thank you for joining us. I'd like to briefly introduce all of our speakers as we get started, and then everybody will provide a brief overview of up-to-date latest COVID-19 information, and we will also then take plenty of questions and answers, and we'll have plenty of time for that. And thanks in advance for those of you who have already submitted your questions. So I'd like to first start with introducing Dr. Denise Bonds. She is in the studio, as I mentioned, with me live today, and she's the health director for the Thomas Jefferson Health District. We also have on camera as well a few other folks who are joining us. So we have Charlottesville Fire Chief Andrew Baxter, and we have Dr. Costi Sifri, who is a UVA Health Hospital Epidemiologist. We have Chief Dan Eggleston, who is the Chief for Albemarle County Fire and Rescue. And we also have Chief Tim Longo, who is the Associate Vice President of Safety and Security and the Chief of Police for the University of Virginia. We will start first here today with Dr. Bonds sharing a brief update on the Thomas Jefferson Health District and COVID-19 in our community.
So I'm going to start by demonstrating how to take off my face mask. You want to untie it at both the top and the bottom and carefully remove it so that you're not touching the front of the mask, which is the contaminated portion of the mask. I'm happy to be here today to answer any questions that you all may have about the pandemic and what we're doing. I think the first place to start is really to explain what the health district's role is in investigating an infectious disease such as this. So in the health department, we get cases that are reported to us, and we will spend time talking to that individual, figuring out where they've been to, and then conducting a case investigation, which will include contacting all of their contacts. Simultaneously with that, we'll also work with the community and individuals in prominent positions to institute safety measures that will reduce the spread of disease. So that's briefly the things that we will work on. We are a state agency, and so we do follow all of the state guidelines, and one of those measures that have been put in place is the stay-at-home guidelines. So this is to help people reduce the risk of contact and is an example of how we would put in place a safety measure. One of the things that I really want to stress today is that we have learned both in case investigations here in the state of Virginia and in case investigations across the country and the world really, that a large number of people who have COVID-19 either have very mild symptoms or they don't have any symptoms at all. And this has really led to a couple of the safety measures that we've put in place. So the first, one of them is the face cloth coverings that both Kathryn and I were wearing. And what this will do is protect other people in the community from getting in contact with your germs. The second thing, or another important factor that's been put in place, is the stay-at-home order. By limiting the amount of time that you spend out in the community, that's going to reduce your risk of coming in contact with someone who might be infected with COVID-19 but doesn't know that they have that disease. A question that I'd like to spend just a little bit of time on is why we don't release all of the information about our cases. And I think the first thing to remember is that everybody deserves privacy. There is nothing that anyone has done wrong to come and become infected with COVID-19. As I said, many people have the disease and don't have any symptoms of the disease. So it's really, we shouldn't stigmatize people who have it. So we have to protect their privacy. The second is actually by law, when we investigate a case of any communicable disease or reportable disease condition, we have to keep that information private. We can disclose statistics, and I'd like to spend just a few minutes looking at what is happening in our community right now. And so if we could bring up the graphic that shows all of the current statistics in our community. So as you see, we have, as of, this is 12 o'clock today, so about as up to date as we can get it, 124 individuals that we know have been tested and reported positive. That includes 6 people that we call clinically diagnosed. That is, they were close contacts of individuals who had diagnosed COVID-19 and had classic symptoms, so a spouse or someone else that lives in the household. Next to that, you see the breakdown by county. So we have 48 cases in Albemarle, 31 in Charlottesville, 17 in Fluvanna, 3 in Greene, 21 in Louisa, and 4 in Nelson. We've broken out the age groups by individuals 60 years and up and 59 years and younger. We've chosen that because that seems to be a good cut point for high risk for a poor outcome from this disease. Now, that doesn't mean that if you're younger and have other what we call comorbidities or other diseases that put you at risk, that you might not end up having lots of complications. But generally, if we're looking at a population, people who are 60 years and older are going to do somewhat worse. So we have 45 cases in that age group and 77 in the younger age group. We have 2 individuals that we were unable to determine an age on. We are today providing information by race. And I'd like to actually thank my staff for really going back and trying to retrieve all of this information, because we know the community has really been interested in understanding biracial groups who is getting this in our community. And you can see that there are 40 cases across the district that are African American or Black, 62 that are white, and 13 of other racial group. We have 9 that we were unable to determine. So for those of you that need a little time doing the math, I'll just provide that for you. So that 40% of, or 40 cases of Blacks is 32% of the total cases. So as we are seeing across the nation, here as well, we see African Americans overrepresented in the number of cases in our community. We have 58 men and 66 female. To date, we have had 17 Blacks hospitalized and 10 whites. So again, an overrepresentation in hospitalized cases of African Americans. We have had 4 individuals regretfully and unfortunately die from COVID-related or complicated by COVID-19. I can't report much individually, but I think I can tell you that there were no African Americans to date that have died of this disease. So that is the statistics that we have overall for our health district at this point in time.
Great. Thank you, Dr. Bonds, for the great overview and information. We will be posting that information later, so it'll be publicly available as well. As I'd also like to mention as we keep moving forward, if you have questions, please feel free to drop those into the Zoom webinar messaging system. We'll take those live in just a few minutes, but please enter them in as we go. Next, we'll jump over to Chief Andrew Baxter with the Charlottesville Fire Department.
Oh.
Probably works better without the mute on. Thank you, Kathryn. So our focus in the city has really been the same since we stood up our incident management team several weeks ago. We're focused on providing essential services to the community. We're looking to identify and support vulnerable populations, for example, the homeless population, and we have systems in place to support them. And then ultimately, part of our responsibility as a local government is to do what we can in terms of encouragement and enforcement, if necessary, in the efforts to flatten the curve to help the health system in the region have the capability to sustain itself in the long term as this disease, as this pandemic progresses. So, and then our participation in the Regional Emergency Operations Center really is focused on those same areas, but just at a regional level as a partner with the University of Virginia and the County of Albemarle as well.
Great, thank you so much. And then we'll now jump over to one of our other panelists, Chief Dan Eggleston with Albemarle County Fire and Rescue. And hold on, Chief, we'll have you restart once we get you. There you go, if you want to start now, thanks.
Thank you. Let me start off first by saying I'm extremely grateful for our strong partnership in the region including the City of Charlottesville, University of Virginia, of course, the County of Albemarle, and Dr. Bond and a wonderful staff at the Department of Health. By establishing those relationships before we had this emergency, I think we're benefiting greatly by that work that we have done beforehand. So like Chief Baxter has mentioned, we attacked this initiative first by establishing an incident management team within the county with 3 strong goals: to reduce the transmission to staff and the public, to protect people who are at risk, and to maintain essential service as a government entity as we go about preparing for an outbreak in our community. As well, as we participate and work alongside with our partners at the Emergency Operations Center to address outwardly focused initiatives such as long-term care facilities, working very closely with those facilities who have at-risk community to make sure that they have the policies and procedures and equipment that they need to protect their residents. And also, as mentioned before, to address the vulnerable population in our community, to make sure we're doing everything we can to provide a safe life for them as we go about managing and working with the citizens to best address this pandemic. Thank you.
Great, thank you so much. And next, we're going to jump on over to Chief Longo, who is the Associate Vice President of Safety and Security for the University of Virginia.
Thanks, Kathryn. Thank you. Good afternoon, everyone, and to my colleagues. I've spent a tremendous amount of time with the gentlemen and the ladies on this call, doing our best to prepare for that which is unthinkable, unprecedented, and frankly uncertain. Here at the university, we've had some difficult decisions to make, as you are well aware. Late in January, we stood up a sub-critical incident management team, which is the vast resources across university grounds and senior leadership, talk about how do we confront this. And as spring break began to get closer, some tough decisions were made at the very highest levels of the university to go to an online learning platform. A lot of work, a lot of energy, a lot of skill from some very talented people in academics, in technology, and then the process of having to slowly vacate grounds to where we're left with probably somewhere in the neighborhood now of 260 students on grounds, maybe some 400 graduate students that we're managing every day as they work through their academic life and doing our best to keep them safe. We made some modifications to our police department's response and service delivery model, the way in which we staff so we can prolong the health of our law enforcement officers and our hospital security personnel who we supervise as well. As the chiefs have mentioned, we set up an emergency operations center, which is a long-standing operation within city, county, and university governance. It was back in the 90s. There was some very smart leadership across boundaries, realized we can't do anything by ourselves. We need each other. And we do rely on each other every day. We stood up the EOC to combat this issue collectively as a region, and we've been doing so for the past several weeks, working very closely now with the hospital, with Dr. Sifri and others, and trying to figure out when that surge will take place, when that peak will hit us, and how we can best prepare for that by housing hospital staff, patients, infected students that remain on grounds in ways that will keep them safe and will care for them well, and to somehow, some way restore this university to the vibrant place that it was prior to spring break. So that's where we are from the university's perspective. And again, I welcome the opportunity to work with these partners each and every day. Thank you, Kathryn. Thank you, Dr. Bonds.
Great. Thank you, Chief Longo. And next, I'm excited to introduce Dr. Costi Sifri, who is an epidemiologist at UVA Health Hospital and will be able to answer more questions as we move forward that are specific to COVID-19 disease.
Thank you very much for having me. I want to start also by thanking all the gentlemen and ladies that I'm joining with today. I think, as mentioned before, these efforts don't occur in a vacuum. They occur as a collective effort across our institutions. And, we have confronted other challenges in the past with a number of things, including infectious diseases, pandemic influenza, Ebola, some other novel issues that have sort of tested our community over the last decade or so. And we're really relying on those same relationships and efforts to see us through these efforts. The coronavirus issue this pandemic is something that we've tracked here at UVA since December 31st. And we started active planning for it in early January as a just in case. And unfortunately, we've seen what's occurred with this virus as it's moved from China, from central China, and then spilled out through the rest of Asia, and then now around the world with some tragic consequences. Much of the effort that we've been working on is changing what our daily operation looks like as a health system, and doing that in coordination and conjunction with the way life has changed for all of us, and from school to workplace, and how we live our daily lives. So that's led to the way changes to the way we see patients through telemedicine, for example, to some of our changes in our operations and the types of things that we're doing within the hospital, and taking care of patients on a regular basis. And I'm sure, as everybody's familiar with, anticipating what could happen if we were to have, and I think we're concerned when we have a surge of patients that have COVID infection in our community. We are fortunate that we have a new bed tower that has been built with several unoccupied floors prior to this event. And so we have some opportunities to capitalize on that new clinical space to take care of patients that are hospitalized. But this is more than just that, and we realize, we understand that. One of the significant challenges that we've dealt with here as a university, I think probably everybody here is familiar with, is been the difficulty in identifying people who have COVID infection. And so with significant effort, a lot of difficulty, we're happy that we have developed COVID testing locally at our hospital, actually multiple different testing platforms to identify people that have COVID infection. That was a national challenge, I think, as everybody is familiar with. But fortunately, through some really Herculean efforts, we have the ability to identify people that have COVID infection that are hospitalized, healthcare workers, and people that are sick in the community. We are see this as a resource, a benefit for our community and really for the entire state. So we've partnered with other hospitals. Martha Jefferson Hospital, for example, was using our testing facilities until things got up and running at Sentara Hospital. We've been extending our efforts to long-term care facilities like nursing homes, helping as much as we can with Thomas Jefferson Health District and other entities to really try to understand the footprint of COVID in our community and in the Commonwealth. That's been one of our focuses. And another thing that I'll just briefly mention is that we recognize that we are a health system that's also has an academic mission, and that we have opportunities to contribute to the health and well-being of our citizenry, not only here in Charlottesville and Albemarle County, but really in the Commonwealth and the rest of the state. So we've had very active research programs taking a look at very fundamental basic science questions like how to develop a vaccine, what are the right targets, how to elicit responses with a vaccine that are protective from infection, to the testing of novel therapeutics for hospitalized patients. I look forward to the rest of this conference today, but we are happy to help, and we also, again, value our community partners.
Great, thank you so much. So first, I'm going to start off with asking a few questions to our panelists that came in prior to the Zoom meeting today. We had folks that submitted a few things early, and a lot of the questions really surrounded upon social distancing and the term of physical distancing. So I'd love to ask Dr. Bonds if you could share with us, what does it really mean to social distance, and is it safe to hang out with your friends on your driveway 6 feet apart from each other and go on walks and bicycle rides?
So that's a great question, and I think it's really important for people to understand. I actually don't like the term social distancing because that implies that you're not contacting your friends and family and checking in on them. So I really prefer the term physical distancing. But what we are recommending is that really people mingle and hang out with family members that live in the same household. They're already sharing any germs that you might have, and so I think that's the safest thing. I think the best way to keep in contact with friends and family is to call them on the phone or use your social media platform of choice, Or you can institute letter writing again. I think that's a lost art, Kathryn, that we could bring back. Maybe set up a system where you send a postcard to each other every day in the mail so that you can see how people are doing. Or if you don't want to or don't have stamps, do a virtual postcard. So I think there's lots of ways for people to keep in contact with each other, but I think really the best way is to do it either on the phone or through your favorite social media platform. Really try to limit your interactions to those that are in the household with you.
Great. Thank you. And I'm going to ask now Chief Baxter. I know the city has implemented a lot of new policies and closed some parks to the public. Can you tell us more about how people can be safe while they're in public settings, say they're at the parks or going to the grocery store?
Sure. I think I would start with focusing again on those vulnerable populations, as Dr. Bond mentioned, people over 60, people that are immunocompromised, that have existing comorbidities or existing other diseases or conditions. And so, for example, going to the grocery store, my 85-year-old mother who lives down the street, she doesn't go to the grocery store. We bring her groceries and leave them on her front porch. And so hopefully people are able to connect with, as Dr. Bonds mentioned, sort of those existing networks to provide the support that's needed to those most vulnerable populations. As far as public spaces go, that same guideline applies. And, there's no desire on the part of the city, or I would say the county, or any institution or elected or government body to be draconian. But this is a case where individual actions impact potentially vulnerable people in the community. So this is why we put caution tape around playgrounds, because we had people congregating, well-intentioned. They were trying to get out of their house and get some fresh air. It's completely understandable. But so we're really trying to get people to understand that even when they're outside, which they need to do, they need to maintain that physical distancing that Dr. Bonds just referenced. And really, this is a case where we're trying to do, for the most vulnerable in our community, and it takes a sacrifice. And we understand that we're asking people to sacrifice. And hopefully, the more adherent we are to these guidelines, the shorter the period of time will be before we can get back to what we would consider to be a more normal social existence.
Great, thank you. And I think that's actually a nice segue into us asking Dr. Sifri if you could talk a little bit more about COVID-19 and how it does affect our most vulnerable populations, and who are the most vulnerable populations?
So COVID-19, the virus that causes COVID-19 is a novel coronavirus, I think, as probably most people understand, called SARS-CoV-2. And I hope you're hearing me. It looked like I was unmuted. The way that it causes illness is through the respiratory tract, and it causes a viral pneumonia. Pneumonia, I think, as everybody knows, is infection of lung tissue. And when you have infection of lung tissue, it essentially that inflammation, that area of infection impedes the ability of lungs to function, to exchange gas, to intake oxygen, and to release carbon dioxide. There is also concern that perhaps as a consequence of infection, you actually develop a cascade of inflammatory products that further exacerbates that problem. And then finally, there is a potential that has been discussed in some circles. There's limited information for it, that on occasion, those areas of lung the damaged lungs can become susceptible to bacterial infection. So you can get a bacterial pneumonia on top of a viral pneumonia. That's still a little bit unclear, but certainly something that is concerning to all of us. And so, as you can see, this is the area of damage is the lung, and the novel thing about this novel coronavirus is that we do not have pre-existing immunity to it. So it's something that our immune system has not seen before, and so both because of that, the virus has the opportunity to cause damage for a period of time before we develop an immune response to it. Is the thought of one way in which lung damage occurs. The other part of that is that maybe perhaps as we develop an immune response, it's robust and then can cause further damage. The populations that tend to be most vulnerable to infection are people that very much like the flu have pre-existing conditions that would lead to poor outcome from a viral pneumonia. Influenza is a very good example of that. So it tends to be more severe in people who are older or have pre-existing medical conditions, including heart disease, diabetes, cancer, hypertension. So those populations tend to have a worse outcome compared to those people who do not have those conditions or who are younger in age. That being said, it can cause severe pneumonia in people who are younger and people who do not have any pre-existing medical conditions. So the physical distancing, social distancing that Dr. Bonds talked about previously is important for disease prevention in people who perhaps you would predict would not have a severe problem with infection, in addition to having the benefit of reducing the spread of this virus in our community, and then perhaps having that through chains of transmission get into vulnerable populations. One difference of this virus compared to flu, however, is that it does not appear to cause significant infection very often in our children, in people who are young. That can happen. However, the reason that that we have schools have been switched to online learning and moved from out of the classroom is because of the concern that transmission within schools can amplify essentially the reservoir infection that occurs within a community, and that can spill out into vulnerable populations. So that's sort of, I think, a long and short, quick answer of how it can cause problems for people.
Great, thank you. And speaking of transmission, I will say we had one question for you, Dr. Sifri, that came up along those terms, and it's from our community member, Lisa, and it says, Dr. Sifri, what do we know about transmission of the virus through surfaces? What steps are prudent to take if we want to determine art or distribute art supplies to kids in our neighborhood? And for example, next week we will be doing a chalk walk, and we want to give chalk to community members and families that could use it to inspire people to who are passively walking or driving by.
That's an excellent question. I think it's a question. Am I unmuted? Okay. It's the question of the day. Is how does this virus, how is it transmitted between people and in communities? And I think we can conclude that the predominant means of transmission is person-to-person transmission, usually through respiratory droplets that land onto people's hands or onto close-by surfaces, and that we inoculate ourselves either by breathing in those large droplets or by touching a contaminated surface and essentially inoculating our mucous membranes by scratching our nose or rubbing our eye. Hence, that's the call for the universal masking that we all started this conversation with. And here's my mask, if you guys are UVA colors. There is concern about inanimate objects perhaps being vehicles of transmission, but they tend to be, we would predict, knowing about the biology of respiratory viruses, they would be high-touch surface areas, things like doorknobs, for example, and certainly handshakes is what I think the predominant concern would be. A box that you get through the mail, or packages from the grocery store, or maybe a box of chalk. I think, while theoretically viruses can survive on a surface for a period of a couple hours or even a day or so, that's not likely to be a significant risk for transmission. I think importantly, what we can really do to reduce transmission is hand hygiene. So if we are cleaning our hands and then touching objects, cleaning our hands after we touch a doorknob, then we are reducing that opportunity of transmitting something from an inanimate object like the door handle or somewhere else in our environment, and then bringing it to ourselves. So I would not be personally very concerned about packages and that there's a significant risk of spread of passing out chalk. But I would also still encourage people to clean their hands with soap and water, and everybody knows the 20-second happy birthday songs guidance, and use face masks.
Great. Well, that's good to hear about packages and such. So thank you for that information. I've seen a handful of questions that have come in asking about more of the data and the demographics. So I'm going to switch to Dr. Bonds here and ask if she can answer a few of these questions.
Sure.
So for our first question here is, can you provide further breakdown on the ages of people diagnosed as well as the ages of those hospitalized and whether they have underlying diseases?
So we can't really provide any information on people who are hospitalized beyond the information that I gave you. I can give you a little bit more information about ages. So as Dr. Sifri said, we're not really seeing many cases in our young individuals. In fact, we've had very few in individuals who are under the age of 19 at this point in time. So, Kathryn, I think that's really reassuring for our families. Certainly a little different, as Dr. Sifri was saying, than the flu. We do have about 15% of our cases in that 20-year-old decade, another 15% or so in the 30-year-old decade, and then we start to see more as it goes higher. We're seeing more like 16 to 17% in the 50 to 59, and then once you get over to that 60, it's probably on the order of 30+%. So that should help individuals understand what the risk. So again, kids seem to be relatively protected, or at least not have serious symptoms associated with this, but we do see cases throughout the age range.
Okay, thanks. And we did receive two other questions from Lori and Carrie that are both asking about fatalities. And so unfortunately, as you shared earlier, we have had 4 individuals pass away in our health district related to COVID-19. Are you able to share what counties these individuals lived in or any other information about their scenarios?
No, we can't. We really have to protect the privacy of our individuals. So if a family wants to release that information in the obituary, that's really something that they can do. But from a health department point of view, we're required by law to protect the privacy, even of people after they've died. I think it's, unfortunate. We certainly want to keep families who have lost a family member to COVID-19 in our thoughts and prayers. But we can't, unfortunately, share any additional information at this time.
Okay. And then we've got a few questions about tests, and then I'm going to move on to another topic. But why don't you tell us briefly what the criteria currently is for testing, and then maybe we can talk about the testing capabilities in this area, how people can access it, who might need to be tested, et cetera.
So, Kathryn, we're really fortunate in this area to have UVA because Dr. Sifri said, they've stood up their own testing program, and that's allowed us to have access to really rapid testing and actually a lot of rapid testing. So currently right now, we will test individuals who are symptomatic and were contact. We'll arrange for rapid testing. We will test individuals in long-term care facilities or employees of long-term care facilities if they're symptomatic and associated with an outbreak. We also have a program set up that if you're a first responder and have symptoms, that we can get rapid testing that way. We are still encouraging the general public, though, Kathryn, to go to their primary care provider. Certainly they want to be assessed for the severity of their symptoms and whether or not they need to be hospitalized.
Great, thank you. All right, so here we have a great question. This is from an anonymous attendee. It says, is the community responding well to case investigations and contact tracing? How can we all encourage very forthcoming and helpful responses to case investigations and contact tracing, especially since it appears that very thorough investigations, tracing and isolation and quarantine will be required to begin to quote-unquote restart the economy and other social activities like opening up schools and businesses?
So a great question, and I have to say that the community has actually been really forthright when we call them. We have a team of trained investigators at the health department. We'll add more investigators as the number of cases increase. And so far, when they're contacting individuals, people have been very generous with the information. And I really encourage the public to share that information with my staff calls. It's important that we get a full accounting of where you've been for the time period that the case investigator decides is pertinent, and that you share as much information as you can about people that you are in contact with. That allows us to get in contact with those individuals, to talk to them about their risk and whether or not they should go into a self-imposed quarantine at that point in time. So I think generally the public's been very receptive to our calls, and I certainly encourage everyone who gets a call from the health department to please return that call and to share all of the information that you can.
Great, thanks. And speaking of reopening our community a little bit, we did receive a question prior to the webinar that was for Chief Longo. If you can talk to us a little bit about when you think UVA might be more open about sharing what day the schools will start back up in the fall. Is there any talk about when you guys will begin to start offering events again this summer and that information?
Well, I think we share the interest of the community to be able to do that, to be back open and part of what the energy is. It makes Charlottesville what it is, and it's a discussion that's taking place every day on grounds and across the president's executive roundtable, his cabinet, if you will, his leadership team, thinking not only about what takes place this summer, but how we prepare for the fall. And because so much is uncertain about when this will actually peak in our community, how long will it take to come out of that surge, if you will, and to be able to begin the restoration process, all that is going to impact how we determine what our continuity of operations will look like in the fall. So the short answer is we don't know. The encouraging answer is that we're talking about it every day and strategizing the what ifs and modeling out various scenarios so that we can continue to be a contributor and a provider of the best education we can provide, the best medical services, and the best venue for the various events that we host here. But it's a work in progress, but it's a work that's taking place each and every day.
Great, thank you. And let's shift gears a little bit. I want to ask Chief Dan Eggleston if you can talk to us about what are the different things that our medics are now doing and how they're responding to this out in Albemarle County and probably likely for other local first responders.
Certainly. Well, what we've done is, first of all, educated our providers about the importance of wearing their personal protective equipment. We've also worked with our regional hospital staff and emergency communications center to better understand the type of calls that are coming in, to better prepare our staff before they get on location. So we've seen great compliance, lots of communications in terms of how we deal with those patients. We're always staying on top of the information that are coming out of CDC as well as the local health department. So far, I think we're maintaining a very good, high quality level of service, at the same time providing protection for both the paramedics and firefighters as well as the patients that we're treating.
Thank you, that's great. I see a few other questions are coming in here about testing availability. So maybe if Dr. Sifri, if you could talk to us a little bit more about if there's testing available through UVA to assess previous exposure, that kind of information that what do folks need to know about UVA's testing?
Sure, happy to talk about it. So we actually have, I think, a total of 3 different testing platforms now for COVID, 2 that are being used regularly on a daily basis. The testing is, as I think I said earlier, we're focused on people who are sick in the hospitals as sort of a primary group, as you can imagine. And we now have a platform that allows for many of those patients, a majority of those patients, for us to determine if they have a COVID infection or not within about 3 hours. Previously, 2 weeks ago, that was a 1-day test. So we've developed, brought on some new testing capabilities to give us answers quicker for a whole host of reasons. Of course, we want to get people to the place that they need care quicker. And we also want to conserve our valuable personal protective equipment, that PPE that you know about, to use that strategically and to make sure that we extend those supplies as best as possible. We also focus on testing for healthcare workers who are sick and patients, UVA patients that are ill and have signs of infection that could be consistent with COVID. When we do that through a couple of our clinics that are located both on grounds and off grounds. It's not a test that's readily available for the UVA health system in all of our clinics, but rather we try to direct them to a couple specialty clinics because of the collection processes that are used and to sort of maintain that strategic use of PPE. So that's how we operationalize it here. So if you're ill and if you're a UVA patient, and then as I mentioned earlier, we have relationships and partnerships with the health department. Previously, we've helped Thomas Jefferson, Martha Jefferson Hospital, and so looking to try to make sure that we can provide the testing that's needed for the vast majority in our community There are also, and we understand and recognize that there are other places that people receive medical care. In private doctors' offices, for example, they're not affiliated with UVA or even with Martha Jefferson. Good news about testing in general is that there is more that is available now. So my wife is in private practice, and she has the ability to do testing through a commercial laboratory. And the good news there as well is that they have expanded access and quicker turnaround times than they once had, like 3 or 4 weeks ago. So what once was taking a week to come back, a COVID test is now taking about 2 days. So I think that's sort of the nuts and bolts of testing availability for people that are sick. Future question that may come up is how do I determine if I maybe once had COVID infection? There's been a lot in the news recently about antibody testing, so-called serology. That is testing that we're looking forward to. We've heard from Dr. Tony Fauci at the NIH that may be available soon. Here at UVA, we're looking at seeing if we can obtain some of those test reagents and start taking a look at that type of testing in the near future once they become commercially available.
That's great. You actually answered one of our questions about antibody development, so thank you for sharing that. And I see we have someone who raised their hand in our Zoom room. It's Laurel Williamson. So we are going to move over to you to ask your question. If you're on. Can you hear us?
Laurel, you should be on with the webinar.
Oh, I've unmuted you. Let's see. All right. Well, Laurel, we will work on this and we'll try to come back to you. If you want to try for one more minute to say something, if we can hear you.
Hi there. Can you hear me?
We can. Great. Thanks for participating.
Well, that was accidental. My toddler actually hit the phone and hit the button.
Good. All right. Well, thanks. Do you have any questions while you're on?
Well, no, I just want to say thank you to everybody for having this town hall, and thank you for everything you all are doing every day. We really appreciate it.
That's great. Well, thank you, Laurel, and enjoy your time at home. So that's great. That was great. That's funny. That makes me laugh. We need some cheer in this time of, can be difficult. So thank you. Okay, so let's move on and talk. I had a question. Let me pull up. Let's talk about this stay-at-home order a little bit more in effect, and let's see if Chief Baxter, are you willing to talk a little bit about any of the enforcement for the stay-at-home order? I know we don't have any police on the line, so maybe this means we need to have another one of these live chats so we can have some folks on to talk more specifically about the enforcement behind this.
Sure, I'll do the best I can, and then I'll defer to Chief Longo as well with his vast law enforcement experience. But I can say that the approach in both the city and the county, and Dan, please jump in here if I get this wrong for the county's perspective as well. But we're tracking the number of calls that we get at the 911 center about potential violations of Executive Order 55, and it's been about 3, 4, 5 calls a day. Those calls are routed to a non-emergency number with each of the law enforcement agencies in the area, whichever one's appropriate. And then a phone call is made to the business or the address that the person is reporting is in violation. And they're directed to refrain from that activity. And then if a second call occurs, then the law enforcement officer would go out and using their PA system, tell the people to stop that activity or disperse. And to my knowledge, we have not had a case where that did not work. Where the simple reminder that they were in violation of the order did not work. And so that approach of educating and people first and then reminding and nudging them second, and then ultimately, if need be, bringing a charge, that class 1 misdemeanor charge. I'm not aware that we've gotten to that point. I don't know if Chief Longo or Chief Eggleston have had a different experience in their jurisdictions.
Thank you. Let's see. Chief Longo, do you want to chime in on any of this?
Yeah, I think thank you. I think Chief Baxter really outlined the process fairly well. I think it's important to put this into context for a second. People know this. we're criminalizing a human behavior that we've never criminalized before. We're asking people that are doing things naturally. They're hanging out, they're having fun, they're socializing. Imagine that. Things we would otherwise encourage in life and people have become accustomed to, we're now assessing criminal penalties to, and asking them to act very differently. And you can't change human behavior like that. And so I think the approach of reminding people, educating people, being vigilant, messaging. President Ryan has sent out messages. Dean Allen Groves has actually went on to locations and engaged students and talked to them about the behaviors and how it's putting them and others at risk. And the police are doing the same. But I think it's important to remind each other, we're at a very different place in time where we're asking people to do things that are natural for many folks. And it's going to be hard to condition them in such a way that it works. And it will over time. And young people will, much like Laurel's child who hit the button when they shouldn't have, will do things they shouldn't. And it's up to us to remind them of what the downfalls of that might be in an environment like we're in. But let's keep in mind that we're changing a behavior that otherwise we would be encouraging and supporting in times that no one ever would have thought about.
That's great, thank you. And we have heard rumors that people think they need to carry letters to prove why they're driving in their car. And we've been in touch with Virginia State Police and they've shared that that is not accurate. So we're not asking for documentation. We are just trusting that the community is really only leaving their homes for essential reasons. But let's shift gears a little bit, and I'd like to talk with Dr. Bonds about race and talk to us about how African Americans or other minority populations in our community may be most affected by COVID-19 and what we're seeing both locally and across the state and nationally.
So nationally, what we have seen is that African Americans have a higher incidence of this disease and seem to have worse complications, Kathryn. So I think I shared at the beginning of this that we're also seeing that here locally as well. So when you look at the number of individuals that have tested positive for COVID-19, we see that that's 32% of the cases that we have, and that's a disproportionate share of individuals. Additionally, we see that more African Americans are hospitalized. 17 of our 27 hospitalizations have been African Americans. So then that leads to the question, the follow-up question, which is why? Why are we seeing this disparity in African Americans? And there are lots of reasons that occur sort of at the next level down. We know that African Americans often have higher numbers and rates of comorbidities that are going to make them at more risk for being hospitalized. We know that African Americans have less access to health care. And importantly, African Americans are more likely to be in our frontline jobs that put them at highest risk. So they are more likely to be home health care workers, they're more likely to be our bus drivers, they're more likely to be people working in grocery and other retail that still remain open, all activities that put them at higher risk. And then I think we really need to get to the underlying cause of all of that, and that is that our country and our state have a long history of racism and policies that have generated these racial inequities. And that's a conversation that we have been struggling with as a community and will continue to struggle with. And I think that this disease has just brought that out even further.
Mm-hmm. And so as a follow-up to that, we do have a question from a community member, Kate, who is asking, what actions are any of you taking to protect the vulnerable populations in our community, like African Americans, like the attention that nursing homes are getting masks to everyone, taking food to people directly? Are we testing African Americans in this town if they want it and for free, protecting and guaranteeing that loss of work due to testing positive will not have a financial impact? If you can share any of that information.
Right, so those are all great questions. At this point in time, there hasn't been targeted testing to African Americans, although the health department is certainly open to that, and we would love to have conversations with UVA about how we could use some of their testing platforms to get more rapid testing and targeted testing to those areas. I think going along with that, we would also have to have conversations with our elected officials about how we can help individuals who are living in high-density housing isolate and quarantine if they are either showing symptoms or they're actually diagnosed with the disease. So those are all conversations that we need to have, and frankly, we need to be having them right now. So I think those are all great points. We are certainly open. I think that now that we have more widely available testing, we're in a position where we can really begin to target this particularly vulnerable group. And now that we have statistics showing that, I think that'll help bring the pressure that we need to really begin to focus on this.
Great, thank you. Another question about testing that we may have kind of answered here is, can you please comment on the availability of wider testing in our health district in order to inform persons without symptoms to know if they have had the disease?
Right, and so Dr. Sifri talked a little bit about this, about the antibody test, and that would be a test that could be done to see if you have developed antibodies but didn't know that you had the test. And that's not widely available yet. We hope that it will be. That'll certainly help inform our policies as we go forward. We do have wider availability of testing. Right now, we're really limiting that to people who are symptomatic at this point in time. I think as testing becomes more available, we can perhaps begin to broach for those working in particularly sensitive positions, for example, working in a nursing home or another area where they're working with vulnerable individuals, whether that would be wise to do testing of asymptomatic. We haven't started it. Certainly a conversation that we're having on a daily basis. I do want to just add in here, while we're talking about testing, one of the questions that we've been asked a lot is to provide the actual number of tests that have been done in our area. And so we have been able to create a data system to do this. It's a little bit of a finagle, and I will say that physicians are not required to report negative tests to the health department. We often hear about negative tests because laboratories and healthcare facilities like UVA will electronically transfer all of their test results for a reportable condition such as COVID-19. But if a provider is using a laboratory facility that doesn't electronically transfer to us, there's no obligation for them to call and let us know if they have a negative test. So today, when we ran the numbers, the total number of tests that have been run in our area are 1,527. That's a little different than the total number of people that have been tested, which is just over 1,400. And the reason for that difference is that some individuals are tested multiple times. One of the strategies to send people home from the hospital or to allow them to return to work is to have 2 negative tests 24 hours apart. So that difference is some of that strategy to get people either back to their home, back to their nursing home, back to their congregate care.
Great, thank you. And speaking of testing and a little bit on this transmission piece, I think this might go to Dr. Sifri. We'll ask you here from a community member, Elaine. Since we have limited testing, isn't it possible that children have mild cases of COVID-19 but are carriers and can transmit the disease? I see groups of unrelated children playing in the streets and am concerned.
Excellent question. And we wonder the same thing. It would be nice to live in a situation like South Korea where we had unlimited testing capabilities to be able to really do saturation tests to identify everybody that potentially has COVID-19, including children, and to understand the footprint, as I said earlier, of disease in the community. If you're able to do that, then we would really have one of the important tools to do contact tracing, to identify chains of transmission, and then to take appropriate actions to try to halt the transmission of virus in the community. A lot has been discussed already by me and by Dr. Bonds about the tests that are available and their limitations earlier and what's available now. It's important to recognize that it wasn't just the test, the reagents in a laboratory that were a short supply. Even simple things like swabs were not available. They're better now, but we still don't have unlimited supplies. We certainly don't have unlimited supplies, unfortunately, of personal protective equipment. So yes, if we could, I think that would be an option to do that type of testing. But I don't think that's going to be something that's going to be available in the near term. And truthfully, I think as sort of things evolve, perhaps the answer to those questions may be provided by the serologic testing. And if I can just go back really briefly to the discussion about testing and social inequities, that is something that at UVA we're very concerned and cognizant about too. We have a multidisciplinary group of people that includes laboratorians and physicians and nurses and ethicists that are specifically also taking a look at the same issue of testing and in the community, and especially looking at communities, including the African American communities and other people of color, where testing may not have reached, and we want to make sure that that can happen.
Great, thank you. And on that note, so this could go for you, Dr. Sifri or Dr. Bronze. We have a question here about what messaging do you suggest for predominantly Black and African American neighborhoods? And I'll see.
I can start. I think one of the important things, and I hope this message is coming out, is that testing does have some limitations. We are focused on people who have who are ill, who have signs or symptoms of am I?
We can hear you.
Okay, fantastic. We want to focus on people who are ill. And I think an important message that has been out there is that, if you're not sick, you don't need to go to the emergency room and shelter in place. And, if you need to call your physician. I think those are all appropriate messages. But I think they can also be, or I'm at least concerned that they can maybe be over discouraging of seeking appropriate care. So, the message should be one of appropriateness. We don't want people to run into the emergency room for sniffles, but we want people to be connected to their doctors and their other providers. So I think it is important that if you are feeling ill, to have early connections with your primary care provider, have those discussions. As we've talked about, there is testing that's available, and there are ways to have testing be obtained. In certain situations, it may be important to say maybe you don't need a test right now. Maybe this is your seasonal allergies. This is maybe not something that you need to be worried about. But I think now that we have some more testing that's available, we want to protect our community. And if we have testing that's available, and understanding that we are social creatures living with people in our homes, we sometimes have elderly parents that live with us, or other members of our household. It's important for us to know if we have an infection that potentially can cause harm to yourself, but also to our loved ones. So I just encourage to have that conversation with your primary care provider. And I'll see if Denise has other thoughts.
Great, thank you. And shifting gears here again, I want to touch base on the term flatten the curve and the idea of the peak, of when is our peak going to be in this area. We have two folks that have commented and asked, Neil and David, community members, that are wondering about the surge and the eventual peak of cases in this area. And so Dr. Bonds, can you talk to us about when are we predicted to have a peak in this area? What does that look like? And what should we expect?
So great question. There are a whole variety of models that are out there that we look at on a regular basis. It's very difficult to get enough data at a local level to predict at a very fine local level. So what we use is the Virginia models, and right now, when we looked it up today, as of 2 p.m., the peak for our area using the Washington model is April 26th. I know that UVA, and perhaps Dr. Sifri wants to comment on this, has been working very closely with individuals at our central office in Richmond to look at Virginia-specific data to see if we can refine that model. I think the important message here is that the more that we can abide by the social distancing, physical distancing, now wearing our cloth face coverings when we're out in the community, seeking testing when individuals are having symptoms so that we can put in place those additional isolation. Those are all things that are going to flatten the curve and bring that peak a little earlier. I think the other important thing for people to remember too is that the flattening of the curve is really to protect our healthcare system. Although it seems very desirable, I would like to be done with all of this as much as the next person. But the reason that we're doing all of this is because it is much better for our healthcare systems, both here and across the United States, if we have a gradual number of cases that allows them to treat all of the people who come into the hospital in an appropriate fashion. So although we would like our peak to be really early so that we can move towards a more normal state of being, I think it's really important to remember that, in fact, we want it to be long and prolonged to protect that health care.
Right. That's great information. And I guess it's safe to say it is community spread in our area. We have a few questions here that are asking about any hot spots, particularly in Albemarle and Charlottesville. There's a question about, is the rate of COVID-19 going up faster in Fluvanna County? And of course, more information about, are there enough tests in TJHD, which I think is safe to say we're working on making sure there's enough tests for everybody. Somewhat limited, but can you talk to us about hotspots? And are you able to tell us where those hotspots are throughout the district? What is a hotspot? What about clusters?
Right. So a cluster is when we have a case, a series of cases that we can link to each other. And I can say, and this is really pertinent because we're in a season of many religious holidays, that where we have seen cases linked together, it's actually been linked to religious events. So funerals, going to church, it's Passover season, all of those are very, very important and a really critical part of all of our lives. Spiritual health is really critical to everybody. But what we're seeing is that when people go to a funeral, it's very difficult to maintain that physical distance of 6 feet apart. Of course you want to hug the family members affected by this and comfort them in this time. And unfortunately, what we've seen is that when that happens, we end up with family clusters of disease. We end up with widespread disease amongst members who have attended that religious event. So it's really critical, particularly this weekend, when we have such important holidays happening for many individuals in our community, that they look at other ways to fill that spiritual need. Can they watch a videotape or a video broadcast of their service? Can we hold our religious ceremonies through Zoom or other social platforms? This is really going to keep our vulnerable members safe in our community, and that's really what we're doing this for.
Good. And is there anything that any certain counties need to know? I know we have the number of cases in Louisa are almost as high as the city of Charlottesville, and Louisa is much more rural than the city of Charlottesville. There's a lot of folks in a small, 12 square mile radius. So what do people need to know right now? I know everyone is interested in the numbers, but what's the big message here?
So the big message is that you're not immune if you live in a rural area. I think that's very important. People think that because they live out on a farm or in an area that's spread far apart, they still are doing grocery shopping every day. Many people are still going to work. You may be going to the post office. You're still having interactions. So although you certainly could be at less risk than someone in a high-rise apartment building, there is still risk involved in your life. And I think the important message to get out here is that you really have to practice your good hand hygiene, practice that social distancing of 6 feet, no matter where you're at. Being in the rural community is not going to provide ultimate protection because you still have those interactions that happen on a day-to-day. So critical to wash your hands thoroughly and often, keep that 6 feet of distance. If you're going to go out, wear your cloth face covering. Really try and maintain that distance.
Great. Thank you. Let's jump over here. Let's go back to Dr. Sifri. I have a couple of questions. A few folks have chimed in here asking about if they should be cleaning their produce and packages that come in through the grocery stores. And I know you briefly touched on this, but I've also seen a lot in the news lately about how you should be, vigorously washing down all the produce that you get at the store. So tell us a little briefly about that too.
Yeah, I don't think those actions hurt anything, right? So I think that if you want to wipe the outside of your bags that other people have touched, wipe the outside of boxes, also with like a disinfecting wipe or lightly a cloth that has a little bit of bleach, that doesn't hurt. And washing your vegetables, I think, is always a good idea. So none of that I think really hurts. But again, in terms of risk reduction, I think it's probably not the most risky activity or the riskiest thing that we encounter on a daily basis is produce. I think it's actually probably more not masking, not keeping 6 feet with other patrons of the store for a long period of time, interactions with doorknobs and number pads and things like that, I think are probably where we probably should spend more of our attention to. But I've seen the same thing. I don't think, again, it hurts, but I don't think if you don't do that, you don't need to be OCD about it.
Great, thank you. And while you're here for UVA, I think there's a question that came in that many people in the community are probably wondering. This is from James, and he asks, are there local medical resources like UVA our local medical resources like UVA Hospital and Sentara Martha Jefferson being strained by the coronavirus situation, or is the situation here pretty well under control at the moment?
That's a great question. I think we are strained in some unique and difficult and interesting ways. So, one thing that we're not straining with right now is patient volume, and we are fortunate about that. When we take a look and see what's occurring around the country, particularly in higher population dense areas like New York, Detroit, Chicago, places that we've been seeing in the news. So we are a benefactor of our geography here in Central Virginia. And that's, I think, true as we have seen around the country, that perhaps a little bit more rural, a little less urban areas are perhaps a little bit behind the curve compared to some of our larger population areas. But I think, as Dr. Bond said, if you think of sort of like Fluvanna County versus Charlottesville is a microcosm, it's not that different than the United States in general. So this is not, I think, going to be something that spares local areas, and I think that it's something that, COVID is something that we will see with increasing amounts in all likelihood in the days, weeks, perhaps months to come here in Central Virginia. And so how is it taxing us? Well, it's taxing us in that we've had to spend a lot of time and effort to change our operations, to change the way that we are seeing patients, and to perhaps reduce some important medical services that people otherwise need, and delaying those. So there are people that are probably watching this right now who have medical plans. They maybe needed an elective surgery or some other procedure, and that's now delayed because it's maybe not the right time to have that procedure done. And maybe there's a better time to do that down the road. Now, not everything can be postponed like that. There are things that still need to occur. So people still need important medical therapies that can't be delayed. So we have to figure out how to do that and to do that in a safe fashion. And so that has led to a significant rework of how we do daily operations. And that is taxing. It's significantly taxing to understand how to do that and what the impact is for patients, and that to make sure that people are receiving the care that they need. So that's part of the issue. And the second part of it, in terms of the being a benefactor of our geography, of being a little bit behind the curve, as I said, is that we're also a little bit of maybe a victim of that a little bit. We're seeing massive PPE shortages in the United States. Things are getting better, but everybody, all health systems, all clinical areas, and all first responders are needing the personal protective equipment that they need to keep themselves safe. And so we've all sort of come into the same market to try to purchase the same things in a world where much of that product was, it was being manufactured overseas, like in China. The significant interruption of supply chain has been massively disruptive and makes us all start to chase after the same limited supply. So that has been a challenge. I think of the challenges that we've had to deal with, I'm happier to have to deal with that challenge than to deal with the challenge of being in New York City right now, truthfully. And we've been, had to be innovative, trying to figure out how to meet our PPE needs. Those include sort of using all leverage and thoughts that we can in terms of supply chains, as I was talking about earlier. We have engineers and people at the Darden School and Architecture School that are fabricating, making PPE that we can use within the hospital and also for our community. And then finally, there's community activities like Equip Seaville that our community partners and other healthcare institutions in the area to help us be safe. So that has been one of the more challenging things that we've had to deal with. And it's something that, like I said, I think is getting better, but we are still working on it on a daily basis.
Great, thank you. I have a question over here for Chief Eggleston. There's a question that came in about how this is affecting our medic teams in the communities, and is this going to change any care for EMS? And then can you also touch on briefly about PPE and what is PPE and what is that availability looking like in our community?
Well, this incident does provide some level of stress to the providers that are out there treating patients on a daily basis. But that's coupled with the fact that we We do have an adequate, at this time, stock of personal protective equipment. We're in constant contact with state and federal officials to ensure that that supply is kept up to date, and we have plans in place if it were to become short, what we do. But I think in general, our level of care has not changed. We're just taking a slightly different approach in terms of how we approach folks who are maybe positive, in terms of making sure that our providers wear the appropriate PPE and we provide the right level of patient care on scene as well as to the hospital, and then the handoff to the emergency department to ensure that while we're providing care that we're not exposing more people than necessary. So I think this has been a hand-in-glove process working with both Martha Jefferson Hospital and UVA to ensure that uninterrupted level of care.
Great, thank you. We did get a few other questions that came in here asking about more of the rural areas. So, our health district does cover Charlottesville, Albemarle, Fluvanna, Louisa, Nelson, and Greene counties. And we shared that demographic data earlier. And I think it'd be nice to hear from Dr. Bonds briefly again about big messages for folks in the rural areas on how they can be more informed, and then asking questions about where they might be getting these cases. And so are there clusters in those areas, which we've talked about briefly, but we've gotten a few more questions I just want to clarify.
Sure. So it's important to keep up with what's going on in our community. And I think, Kathryn, your group at the Joint Information Center has really been doing a great job of pushing messaging out. And so I think looking at our Facebook page, providing messages that way, certainly keeping up with the local news. What we're finding in many of our rural areas really is what we would find with any communicable disease, right? Many of these individuals who live in Greene County or Nelson County or Fluvanna or Louisa actually drive to Charlottesville and Albemarle and work here or do their shopping here. Some of the clusters that we're seeing are family related, so individuals that went to a particular family gathering, either a religious event or a funeral or other type of family gathering, and then we had several people who live very close to each other in that community become positive with the disease. I think it's important to remember that we can't really release a hot spot. This is a disease that's transmitted from individual to individual. There does seem to be some delay in how quickly the virus dies. So as Dr. Sifri was talking about, if you go to a bank ATM and use the ATM and the person before you had the virus on their hands and touched the keypad, now you've picked it up on the keypad. And so that really goes back to the message. It's less informative to individuals to know where cases are individually located, and more important for everyone to practice good hand hygiene, that long, thorough washing of your hands multiple times a day, really keeping that distance of 6 feet from other individuals when you're out, wearing your cloth face covering to protect other individuals from germs that you may have, and then really stay home. We really need people to stay home. That will keep you safe, that will keep your family members safe. So really the message is follow those guidelines that have been put out by the Virginia Department of Health, the CDC, the World Health Organization, and I think that should be the focus, and less on the addresses of individual cases.
Great, thank you. And I will also give a plug that the Thomas Jefferson Health District has set up a hotline. So we have a phone line that's available, so folks who might be in rural areas that might not have as much internet access can at least give us a call if they have hopefully a landline or cell phones. The number is shown on the bottom right of your screen. It's our resource hotline. We can direct folks to any type of resources they might need. So if it's financial support, daycare, food services, or if they have questions about COVID-19, they're wondering if they need to be tested, etc., we can help them out. So give us a call on weekdays, so it's Monday through Friday. And that said, I think that we should start to wrap up. I'm going to go around the room with our panelists one more time to see if there's other information that they can share. We appreciate everybody participating, and if there's a need for this, we'll continue to do this more often. And if you had a question that we didn't get the chance to answer, please give us a call at our hotline, or you can email us at tjhealthdistrict@gmail.com. But to start off, let's go around and we'll have Chief Baxter if you'd like to share any last thoughts.
Sure. I would just like to remind folks in the community there are a lot of people working very hard, providing essential services. Obviously, our firefighters and paramedics and police officers and deputies, but there are also a number of other categories of employees of local government that are out there: bus drivers, electrical inspectors, utilities workers, all the folks that are providing services at those businesses that are still open, at the grocery store and other places that are providing essential services. And we need to stay home for all those folks. We're protecting them as well. And so it's just vital that people heed that advice. And we know it's difficult and it's a stressful time. And I would just add one other thing, which is Dr. Bonds touched on this as well, but please stay connected. That's the most important thing. We are social creatures, and there are a lot of opportunities to do that now that didn't exist not that many years ago, to stay connected with our loved ones and our friends and our coworkers through social media and phone calls. And I'm going to start letter writing, Dr. Bonds. That's intriguing. I'm going to do.
That's great. Thank you so much. And how about Chief Eggleston?
Well, I agree. I think there's a lot of folks out there that are working very hard to ensure that the essential services are maintained. People can get their food and water and items that they need to sustain their livelihood. I would say that people leave and people enjoying the outdoors, and with the closure of the Shenandoah National Park, it puts more stress and pressure on our parks to remain open and be vibrant. And that's why last week we instituted a ambassador program for our parks, and we got some great feedback for that to ensure that folks maintain distance in terms of how they enjoyed the parks and interacted. But it's a great opportunity for people to get out and safely enjoy the outdoors in this beautiful spring weather. So I think there's a great opportunity to maintain that distance, respect the folks that are working hard to ensure that we maintain a good livelihood in our community and do it in a safe manner. Thank you.
Thank you. And how about Chief Longo?
I certainly share the sentiments of my colleagues. What makes me so proud of being part of this community is the heart that people bring to this discussion every day, whether they're in a neighborhood, in the hospital emergency room, on the back of a fire truck, in the emergency operations center, or in line at a grocery store. People care about each other, and they're reaching out every day to help this community sustain, so that when we get beyond this, we'll be stronger, we'll be more hopeful, and I think we'll care about each other more and the things that we have. And so I hope we come out of this a better community. I think we will. I think we have the heart to do that. And I'm so grateful to be part of this community, and I'm so proud that I work and live in a place where people are contributing every day, no matter what they do. They're making a contribution. So thank you. Thank you for hosting this.
Great. Thank you so much. And Dr. Sifri.
Yeah, I too want to really echo notes of gratitude and appreciation for the our first responders and for our employees in essential services, and of course for the healthcare workers that are going to work every day to take care of patients and to take care of people who have COVID, which is can be scary for all of us. But one of the biggest notes of gratitude and appreciation that I want to mention is that of the community. What we've been asked to do as a community, and that our community has done in terms of physical distancing, social distancing, developing new ways of working and learning and attending religious services remotely, and these other things is really, I think as said earlier, it's just protect us, to protect the healthcare workers that are seeing patients. And we understand this is a really, really difficult time for everybody. There are people who are not working now and are taking, to have significant financial problems or challenges that they're going to be looking at because of what's happened. And so we understand that. Again, thanks. I want to thank the community for doing what is, in essence, something to protect us who are in healthcare. Thank you.
Great, thank you. And Dr. Bonds, any last words of wisdom for us?
Well, I think I've said all I need to say today about social distancing and physical distancing. I do wanted to share, I was asked how this experience has changed me, and I will say I am just humbled by all of the effort and work that has really gone in, both by all of the individuals that have been on the line with us today and the various constituencies that they represent, but also the individuals in the community that have completely disrupted their lives so that we can protect and really keep safe our most vulnerable citizens. And I think that that's just so amazing that our community is really willing to upend their entire existence so that we can keep other people safe. So I guess I would end by asking everyone to continue to stay safe, to stay 6 feet apart, and to stay home. Please to reach out to us if you have any questions or need any assistance.
Great, thank you. And thank you to everybody who's participated today. Again, if we find that this is a need, please let us know and we will have more of these community sessions. You can always reach us. You can give us a call at the hotline number that's listed on the bottom right of your screen, or you can give us an email at tjhealthdistrict@gmail.com. Also, check out our Twitter and Facebook pages. We are posting numbers frequently on there so people can stay up to date on the latest cases in our district, as well as other resources for mental health and other great ideas for what you can do to stay busy while at home and for appreciation for our healthcare workers. Thank you for everything, and we will be back in touch.